And fantastic. And we're live. Good evening, ladies. Thank you so much for your patience. We are now live at this webinar where we've come together as we continue to celebrate Breastfeeding Awareness Month after Breastfeeding World Breastfeeding Week. And today we are going to talk about how to protect working mothers who are breastfeeding as part of this year's theme of Protect Breastfeeding, a Shared Responsibility. And on the panel today, I have Esther, who is a nutritionist at the Nairobi Metropolitan Services. I have Martha, who is the founder of the Career for Exclusive Breastfeeding Mothers, CAMFED. And then I have Eve, who is a CAB member, the Kenya Association for Breastfeeding member. And then I also have, I don't think she has joined the live yet, but I also had Naomi, who is an entrepreneur. But let me first begin with the ladies who are here. Kindly please introduce yourselves. I know I've mentioned just the names and just titles, but please tell us more about yourselves and specifically how you feel that the work that you're doing protects breastfeeding and also more so protects the breastfeeding mother. So Esther, if I may please begin with you.
Okay, so good evening, viewers. My name is Esther Kwamboka Mogusu. I work with the Nairobi Metropolitan Services. I'm a nutritionist by profession and a breastfeeding advocate and an MRICN specialist in general. So my duty as an MRICN specialist is to, first, I support the ministry in doing policy, and I also do frontline work that is supporting mothers directly. So I build capacity, and I'm able to support mothers to just do the right thing. And doing the right thing is giving the best start for their babies, and this is doing exclusive breastfeeding. And in my advocacy work, I have been out there, like in the past 1 week, I've been out there in the media and in several forums, just convincing everyone how it is important to protect breastfeeding and how everybody should take up their role to support a mother to breastfeed.
Thank you. Thank you very much, Esther. We'll definitely come back to you, I think, especially in terms of understanding how perhaps the deregulation from county level to the Nairobi Metropolitan Service level may have also hopefully enhanced, because I guess that was the idea in terms of enhancing capacity building in this respect, but thank you for that introduction. Next on my screen, I am seeing Eve. Eve, please introduce yourself.
Good evening, ladies and the moms who are live. My name is Evelyn Kongoro. I am a lactation specialist. I'm also a lactation education trainer. I am a mother. I am a finance specialist, and I also run a breastfeeding business. So how I support breastfeeding is just getting people together. I enjoyed putting women together, mothers to be, and new mothers, and just taking them through classes, giving them the confidence to be able to overcome the challenges of breastfeeding. I also like to work also with their partners. When I'm working with them, I like working with their partners to be able to just arm them with the knowledge to actually go through the whole breastfeeding process. Yes.
Okay, thank you, Eve. I know you will also have insights, like you said, in terms of all those roles that you play, also as a mother yourself and working in being in full-time employment. Also, I'll be curious to hear about how that has worked for you. How does your employer support you? Whether or not being a lactation specialist was obviously an added advantage, if at all. So that would also be very interesting to hear about. Thank you for that. Martha, please, your turn.
Thank you very much, Josie. I'm happy to be here. I don't know whether I'm audible. I'm fine. All right. So my
Yes,
name
you're
is Martha
audible.
Mugi
Thank you.
Kimkung. Thank you, Josie. So my name is Martha Mugi Kimkung from Career Mothers for Exclusive Breastfeeding. I'm the executive director and founder for CAMFEB. I'm also a lactation specialist, and always happy to work with moms to see that we achieve breastfeeding. I love breastfeeding, and so ideally I would say I'm a breastfeeding advocate. So anything to do with breastfeeding, I'm happy to be there. So what we do ideally is we support moms in terms of raising awareness to the society on the importance of breastfeeding. So we have a few programs that we run at CAMFEB, which maybe we'll come back to that. And also for me personally, I work with moms whereby if we have moms that are going through challenges in terms of breastfeeding, I do home visits. So that is the other part that how we support breastfeeding. Thank you, Josie.
Thank you, Martha. I'll also be very curious to hear, especially in terms of now working with different organizations, how has it been for you over the years? Because I know you've been very active in the advocacy scene, so and very inspiring to many of us as well. And then I realized that I forgot to introduce myself as the moderator, but I'm Josephine Munene to the audience, and I'm a infant and young child feeding counselor, lactation educator, and I'm also the honorary secretary for the Kenya Association for Breastfeeding. So I'm incredibly passionate about breastfeeding and understand things that we have to go through, especially as working mothers. I remember my eldest son is now 11 and a half. And when I had him, I was working for a big company. And at the time, I mean, breastfeeding was not, it was not spoken about as, let alone a public health issue, but even a problem that any mother should have. And I remember that is what got me into this field. But more so, I remember my shock at there not being any facilities in the company that I worked for. That my colleagues and I, who are also breastfeeding at the time, had to breastfeed either in toilets. If you had a car, you were very, very lucky, and maybe meeting rooms. So I would hope that that has changed, and from the landscape of things and from the new legislation, even especially with the Health Act, Section 71 and 72, that call for lactation rooms, that call for protected time, we hope that that has changed. But let me throw this to you, Eve. As I said, because you work full time and you're a mother of two, how has the experience been for you? Working in a big institution, and I'm hoping that it wasn't as harrowing as mine. How has it been?
So, thank you, Josie, for the question. So I have 3 kids now. 3 kids
wow,
now.
Congratulations.
So let's start with the first bit, the firstborn. The firstborn was a bit of a challenge, yeah, because this is where everything is just new. You know, you as a mother is born, and then you go to work. Of course, you have your maternity leave. You have your maternity leave, and then you go, and then you go to work. You resume work, and then of course this was a time when there was still no. I don't think the law had been put in for creation of breastfeeding rooms, but when came my second born, then there was my organization actually created breastfeeding rooms, you know, well equipped, you know, with fridges, chairs, comfortable chairs, sockets, you know, everything to actually facilitate the process. I know my organization has also supported me in terms of flexi hours. Basically, you can come into work late, leave early, so that you're actually able to be able to breastfeed, breastfeed. Other than that, I think my biggest challenge in resuming work and the workplace is that time. I think the time you're trying to beat your deliverables. At the same time, you're trying to make sure you have milk. At the same time, it's not, sometimes it's just not practical to walk out of a meeting to go do a session of 15 minutes pumping, and then you come back, every 2 hours. So there's always this sort of fight, yeah, for lack of a better, there's a fight between meeting your deliverables and actually keeping your milk going, because that's the point, to keep your milk going and keep your supply up. So for me, that has been my greatest challenge. So I'm happy. I'm happy you're here to actually sort of discuss that, because for me that is my greatest challenge. That's what I've seen with my second and my third one.
Yeah, and I think that's a very good point regarding how many people are actually aware of their rights, and even that those sections in the Health Act exist. I think, Esther, as a policymaker, where do you feel that that gap comes in terms of the policies that have been made, the legislation that has come into power, but why is it on the ground that most mothers don't even know that they're entitled to that 1 hour for every 8 hours worked, and that they can approach their HR managers and tell them, I am entitled to this time? Where do you think that disconnect comes in, Esther?
Okay, thank you, Josephine. So we're glad that we now have legislation, but then I must say that the enforcement of that legislation probably has not come out very strongly, because this legislation was passed in 2017. We are in 2021, that is 4 years later. And I can actually attest to that very few organizations, there are some who have tried, but a lot of organizations do not have those breastfeeding stations for their workforce. So it is important that as government, because I am in that government, that we actually go out there and really enforce and ensure that every organization has this breastfeeding space for their mothers. The lactation station doesn't have to be very elaborate. And something that the employers need to know is that this is a space that you will just have a comfortable seat, probably some refrigeration if you can afford it, just some cabinet for your staff to be able to store their expression equipment. But majorly, it is the privacy. For a woman, the privacy is the most important. Breastfeeding is actually managed through hormones. And if the mother is not relaxed, if she does not have the confidence that somebody is not going to walk through that door and find me naked expressing, then that is going to be like very demeaning, and her dignity is going to be violated. So for me, what I would actually say, and my appeal would be that employers need to take this up. Nobody needs to whip anyone to be able to take this, because we must respect our female workforce. Number two, our gender collaborators, they also need to come out and fight for the woman and ensure that our women actually have a proper place. It is not a mistake to be a mother. So mothers must also be accommodated in the workplace. And also our government, again, we need to go strong on the enforcement. I know Martha and CAMFEB, they have come out strongly to advocate for the rights of the breastfeeding mother. So it is something that is commendable, and many other organizations, but we need to see more. We need to see a lot of the CSOs actually coming out and advocating for this space, so that working mothers are actually supported.
Thank you very much, Esther. And it's true what you're talking about, accountability, because I feel that even as even employees themselves, as women, as mothers, we are scared to hold our employers accountable, because you're scared of repercussions. Because by the time you're going to tell HR, this is the law, this is what you have to give me. We feel sometimes a bit intimidated in terms of that. Now, let me welcome one other speaker, always better late than never, Wangari Karibu Sana of Moms by Kari. I'm sorry for the technical difficulties that you experienced, but please introduce yourself and welcome to this discussion.
Thank you. My name is Naomi Wangari, CEO and founder of Moms by Kari. Thanks for having me, and I'm sorry for being late.
Don't worry. Please tell us more about yourself and how you feel that your passion for breastfeeding and the role that you feel that your work plays in terms of supporting working moms, what your experience was. If I'm not wrong, you've also come from full-time employment into self-employment, what your experience was in full-time employment, how that transition, because sometimes we also assume that self-employment and working from home is easy as a breastfeeding mom, but sometimes the experience actually isn't. So it would be really nice to hear from you in terms of what that experience has been.
First of all, I'm a mom of two girls. So my journey started 6 years ago when I got my firstborn, the breastfeeder. I was really I was working. I was fully. I was working out of town. So my daughter was in Nairobi and I had working. So it was really, really crazy. I thought mentioning about
Sorry, Wangari, I need to interrupt you. I'm so sorry. I can't hear you clearly. Is it possible? Are you using a mic? Is it possible to hold your mic closer?
I had to join through the phone because my laptop issues. I don't know. Can you hear me?
Sorry. Now? Don't worry about that. Yes. Yeah. If you need to, it's okay if you need to turn off your video, that's fine. Are you still there?
Yes, I am.
Okay. Your audio is still a bit low. Sorry, the technical issues that we are always this new age.
Hi, better. I know.
Much better. Thank you.
Better?
Thank you. Much better. Thank
Okay.
you.
Okay.
Right. Yeah.
So as I was saying,
you were telling
apologies
us you
for
used
that.
to work out of town. Yeah.
I used to work out of town. So you can imagine there's a time I need to express before I leave the office, because you can see from Nyeri to Nairobi is like 4 hours drive or something. There's no place to express. There were no, I feel that we've really, really grown from then. There are so many stakeholders who have come on board, and so many companies which have been built around breastfeeding. So it's much better now. You can imagine there's a time I used to get home, I'm on fire. I don't even know where to start. My boobs are on fire. Everything is it's just crazy. So I can say, first of all, we've really, really grown as a country in terms of where we are in terms of breastfeeding. There are so many companies that have come through, lactation specialists, and that's why I decided to even start my company, because even there was nothing friendly to wear. It got to that point, there was nothing you would even wear. There's no place you can get an affordable nursing bra. There's nowhere you can get, even you guys, the pumps. It's really, really, you couldn't get a proper pump. You can imagine trying to pump with a manual pump. And, it's just crazy. Anyway, so you had mentioned the journey.
The transitioning from there with your first, and then now coming into self-employment, the assumption that you're working from home, that breastfeeding as a self-employed mother is still going to be easier. Have you found that?
It's better. Let me say it's better than when I was employed. But at the same time, being an entrepreneur, you still have to run business, you still have, so you can imagine you have to schedule, you have to be really strict, scheduling when to pump, and also really, really want support from family, friends, because you're still working either way. Actually, I feel when you're self-employed, your hours are more than when you're in the office. But working from home is much better. And as I said, there are so many, I feel there is support, there is more awareness now than then. There's more, even like the government passed even the breastfeeding bill 2019. We're headed somewhere, which is a good thing. We're really, really headed somewhere. If you compare 6 years ago and now, it's much better. It's much better. Yeah.
Okay. Yeah, thank you for sharing your insights, and especially the fact that the support from family helps so much, even when you're a self-employed mother, even if you're working from home, because the hours are even more demanding and more unpredictable. And that also links into the theme for this year's World Breastfeeding Week, which was it's a shared responsibility. So it's not just on the mother, it's not necessarily just on policy, but even our family members and on community level. Martha, I think I'll come back to you and ask you, in terms of the work that you do, the wonderful work that you do, bringing awareness to the needs of working mothers, especially in formal employment and in full-time employment, what have you found has been maybe the pushback from employers, or what have you found to be your greatest challenges in your advocacy journey?
Thank you, Josie. So some of the challenges I would say is that number one, we do not have our employers well informed in terms of the importance of breastfeeding and why it is really, really important to support these moms to breastfeed. So I think we really need to sensitize, especially the employers, why it is really important for them to set up lactation rooms for the moms. Something else that we face is that somehow the employer feels that they do not have that particular space to sacrifice for the mom and set up a lactation room, because maybe, for example, if it's an organization you only have one lactating mom, they will think like, you know, I'm sacrificing this space for only one mom who is breastfeeding. So they end up like seeing that it is not an urgent thing to do. But now on the other hand is that what we do not see or maybe consider is that you will have one mom in one organization and you'll have another mom in another organization and maybe a million moms in different organizations. And so you will find that we are not supporting these moms whereby it is the whole society, the whole, all the women are not being supported to breastfeed. So we have found that the issue of creating space is a big challenge, because also this is something new that has come in, and for organizations that have been there already, they feel that they really need to look for this space that they are not finding. So also the other thing is what I've mentioned is that they feel there isn't that urgency to set up the lactation rooms for the moms. So I think, as Esther said, is that where I think the missing link is the implementation bit. We have like the awesome act that needs to provide for the moms the space, but how to implement that, that is what we are lacking. And we would love so much for the government to come in and see really what can be done to push this and see more and more organizations setting up lactation rooms, because really we have very few that have set up. And although I can say there's a bit of progress, but we could really do better than that. Yes.
We can do better. Before I come back to you, Esther, because actually I had another question regarding now this new bill. But for you, Eve, how has it been? What the challenges that Martha has just described in terms of companies not having a buy-in? Why do you think for you, the organization you work for, had that strong buy-in? Did it come from management, or did it come from push from now the employers, the working moms?
I think it's both. I'd say it's both. Yeah, I work for a great organization. I always say that because we have a very strong HR. We have a very strong HR who are always up to date on certain issues. And I guess it helps that then it was it was a multinational, yeah, and it's in a wide Africa. So a lot of HR policies are more global directed, and just the fact that it's Kenya. But also there was also the push that came in, because I remember when I had my firstborn, I remember that the advocacy was also coming for the rooms. There was also the push and the pull coming also from the mothers who are also getting frustrated with the challenges around. You don't have a space to actually just sit down. You know, that privacy, that privacy that you were talking about, where you don't want someone barging in, or you have to go breastfeed in your car or in the toilet. In fact, the toilet was the most common one. Yeah. And then I like what Martha is saying. Yeah, fine. I feel that it's not just about the room. Yeah, fine. The room can be there. Fine. We've created a room, but then do people understand why that room has been created? Are we actually encouraging? How many mothers are actually going there to actually do their thing, to actually do the expression there? And are we allowing these people what is the support around this mother? Are these people aware that this mother should be actually going there to actually have that pumping session? Yeah, because the rooms can be created, yes, but you know, you're there, you're running around. I mean, you're trying to get your work done, and you're trying to you know, maybe at lunchtime, and you know, you're still expected to deliver on your normal working hours, which is also against. You may have the room, but you're still expected to actually work your normal hours. Yeah. So then the only time you have is like lunchtime, where you're hurrying to eat lunch, you're trying to breastfeed. I mean, you're trying to express, you're trying to, you know, it's stressful. The milk supply will go down. So this is what this is for me. We may, the organizations may be having the spaces. Now those who have spaces have the spaces, but how many people actually, do we take statistics? How many people are actually using them? What is the experience in that room? How can we better that? Yeah, for those who have actually gone that way. Yeah.
Yeah, that is very true. Again, that sensitization that Martha had spoken about. For Esther, there's this breastfeeding mothers bill that was sponsored by Honorable Sabina Chege, and it talks about penalizing the companies that do not meet those requirements. Do you think that is an actual, a sustainable and feasible, let me say feasible way of accountability? Is it the most feasible way of accountability, especially if that bill comes through? Because I feel that it fleshes out the two sections in the Health Act, and it adds penalization, it adds accountability. But do you think that would actually be quite feasible? What are your thoughts on the bill?
Well, I know the bill is the bill is under discussion. We are now receiving the public input into it. And really, there's something interesting about Kenya and penalization. We really understand the language of penalization. So when an employer hears that if I don't do this, I will have to do this, so I'll have to probably be penalized in this manner, then maybe it is going to lead them into, just into complying with what the law says. But I think something that just came out is very clear, that there is very low awareness sometimes amongst our employers. How many directors of companies are aware of the Health Act 2017, for example? How many of them are even aware that they are supposed to be complying with that act and that it affects them? How many human resource, like HR specialists, are aware of this act? Because when we are thinking about working women, where are they working? They're working in organizations. Who is heading these organizations? The directors. Who are in charge of the workforce? It's the HR specialists. And then again, about the spaces. We have our counterparts in the building industry, okay? So how many of them are aware that when I am planning a building, I need to set up a lactation station? At least I'm glad that these days in the malls, the big malls that are coming up, we actually have such spaces. But in many other organizations, many other buildings, we do not have the layout of the building, including a lactation station. And then again, about awareness. We create awareness around so many things. And actually, somebody challenged us in a function where I was with, I think, Martha, Josephine, you were there. And somebody actually told us, why can't we sell breast milk the same way the breast milk manufacturers actually sell their wares? We need to cultivate this language. We need to entice people. We need to advertise breast milk just in the same way. And in that way, you advertise a product, you need to take care of the source of the product. And these are our mothers. So when we actually empower our mothers, when we orient, if a mother is going on leave, you have a female employee, and the employee is going on leave, the human resource manager needs to call her probably and just assure her that when you come back, we have this room and we are going to support you through the process. And feel free, you can always come back. We are going to give you flexi hours. We are going to do this and that for you so that the mother is encouraged right from the start. And something else, just to tell to our mothers and even to the public and to all of us, the support at the workplace needs to start before, okay? Orientation. The healthcare system in which I work, we actually have a huge role in informing the mothers of the rights and also of how the law takes care of them out there. We have the Employment Act of 2007. And what does it say? The mother needs to have paid maternity leave. The father of this child is entitled to 10 days paternity leave. So during this period, the father is supposed to support the mother to be able to set up her, like set up systems that are going to work for her during the maternity period and beyond. Something very interesting, and I think most mothers do not know, is that preparation for going back to work should start as soon as she delivers. How does this start? Expression of breast milk should start immediately. The mother delivers, because in those first days, there's normally a lot of milk, a lot of milk, breast milk that the baby cannot be able to consume. And remember I said in the beginning that breast milk and the breastfeeding practice is actually controlled by hormones. So that time the hormones are active. And the more the milk that comes out, the more that continues to be produced. So in the breastlands that I need to make so much milk now and in the future, then it's going to continuously produce the milk. And that is how the mother, even after returning to work, she will have enough stock to live at home. She'll not be very worried about the baby she has left behind. Then her breasts are not going to dry up because she's back at work, because they're already trained to produce the milk. So in the lactation station, she'll produce enough. When she goes home, she's going to have enough to breastfeed her baby and also to express more and leave behind. So this message is actually a multi-sectoral, we need to give it a multi-sectoral approach. While government has put in the legislation, we have every place in society, the healthcare system, we have the employers, we have even the public, even the families, they need to support the mother. So for me, I think it is an awesome bill, the breastfeeding bill. Let us wait for it, it's going to come. I know whether it's punitive or not, it is a responsibility we have to the women of this country. It is not a crime to have a baby, so every breastfeeding mother should be supported at the workplace.
Yeah. Thank you. Thank you so much, Esther. So many wise words. You've also reminded me of what that lady said. In addition to, if there are smoking zones in town, why can't there be breastfeeding zones? How have we elevated, how have we forgotten and ignored the mother so much that we are looking after smokers more than we are looking after the mothers? So that is a message that also hit home for me. But thank you. Those are so many wise nuggets, and I really hope that the breastfeeding bill does come through and that those companies are held accountable, but very, very many wise nuggets. Even the idea of access to that specialty knowledge where, like you've just said, you know, encourage a mother to start pumping, because it means that if she's able to breastfeed her baby to satiation, then she's able to even pump after that. Her body can support that. Her body can support breastfeeding her baby until her baby is full and also express enough to store. So this is something that access to knowledge, you know, is also very, very important. Multisectoral, as you've said. Thank you so much for that.
Go ahead. There's something I really like what Flossie is saying, and I like the whole project that has come from end to end, and it brings something in mind for me. And this is the gender diversity and inclusion, and which is also in line with the sustainability agenda of gender equality. Right now, you're seeing organizations trying to push for 50% of women, and when you actually go down to the source of why sometimes women are not taking certain roles, they are being forced to choose. Like you're choosing, I want to take care of my family. And for me, this, when we are having such discussions, for me, it's an upstream way of actually making sure that women in the workforce are actually able to work. You know, they are never in a situation where you're choosing to take care of your children over a promotion. You get, and some of this, and this is Flossie's case. Flossie's case, the company is sort of it's almost a success story for me, because they did it from end to end. They saw that they have supported, they have provided, they have educated, they have empowered. You have a man telling you, oh, you know what, it's your 15 minutes, can you go and express? You know, that's the kind of support we are actually advocating for. This is where we'll be able to actually include women and ladies who you know, you're never going to be in a place where you're choosing, because you are supported, the equipment is there, you're not worried that my child is suffering because of lack of nutrition or something. So for me, this discussion around lactating rooms, providing mothers, is a big agenda for me. It goes all the way to the sustainability agenda of gender equality, diversity, and inclusion. So for me, Flossie, your company sounds like a really success story. Our companies, I also say my company has been very, very, very good at this. Very, 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 very practical in this. I always feel there's more we can always do. All over in all corporates, there's always more we can do. Much more. And yeah, kudos. But for me, that it's a big agenda. It's an upstream direction in terms of the sustainability goals. Yeah.
Okay, may I come in?
Yeah.
Yeah. So,
yes, please. Yes, please.
So Flossie, I think what you're doing is amazing. Just listening to you and the testimonial of the benefits to the company and even the benefits to the women themselves. It is actually amazing. And I think your fears about doing too much, I don't think there's too much that you can do to make a woman comfortable, more especially when she's giving you her all. Because remember, mothers are very faithful to anybody who is going to support them. Yeah. And I like the idea that we have involved the men. So we know that breastfeeding is a natural process. And so for the men to actually accept that our female counterparts can take time off so that they can go and express their milk for their children, then that is really wonderful. So I sort of see an adoption of a workplace policy where you have normalized breastfeeding. You have actually normalized expressing milk for the baby. And I think this is what every workplace actually is supposed to do. So we need to come to you and actually benchmark and just refer many more organizations to you to actually come and benchmark. So you're not doing too much. So yes. So it is a wonderful thing. And just as I'd said, that our CSOs really, they have a huge role to play in ensuring that they're implementing what the government has already legislated. So while we are waiting for regulation, let us carry on with the legislation. And I think the advocacy bit is very, very strong. I like the way you've turned around the CSR bit. You know, a lot of times organizations think a CSR is going to do a shed at the bus stop or, you know, something, just something funny. But you see, in this case, they've actually provided that lactation station, they provided the equipment, and they've actually supported the women. And we can see the return on investment. Yeah, the return on investment. The company is actually, it's actually gaining. Mentioning something around COVID again, it is something that I think has worked positively for our mothers. Regardless of the fact that we've had challenges around mothers with COVID breastfeeding their children, there have been a few misconceptions out there, but then just reassuring all of us that COVID is not spread through breast milk. And really, a breastfeeding mother actually passes on the antibodies to her child. So COVID has worked positively for us because mothers have been working from home. A lot of mothers have been working from home. So our exclusive breastfeeding rates clearly must have gone up. And I'm imagining how the KDHS, the Kenya Health Demographic Survey, statistics are going to look next year, okay? So I believe we are going to have improved to our target of 75% by 2022, because then this is what we are aiming as a country. So for us, COVID may have come, it may have interrupted a few things, but then it has not entirely destroyed our focus and our target for breastfeeding. So this is commendable, and I thank all of you and all the organizations out there that are just advocating for breastfeeding for the woman. Maybe one last thing. While we get support, and probably to CAMFEB and to the other organizations, I know there are some organizations out there which are going to support breast milk manufacturers. I know we need to be careful around where our support is going to come from, okay? Where our support is going to come from. I personally once turned down an offer to donate breastfeeding spaces or stations for several health facilities in the county of Nairobi. Why did I do that? Because after investigation in the background, there was actually a breast milk manufacturer who was behind the entire concept. So let us be very careful about our funding sources. So while it may look like it's a good thing, we may find that behind the good, you know, like behind the good gesture, there could be a source that is really not very supportive of breastfeeding. So let's be careful about our funding sources, and together let's support breastfeeding women.
Thank you so much, Esther. I think there's so much even to be to be said from what you've just mentioned. And I was even just thinking about, oh yes, just breast milk substitutes in terms of even the working mother, but that is a completely different, it would take us down a completely different rabbit hole, but those are very wonderful parting words. I think I can start asking everybody for their parting words, but especially the challenge that you've also put out there for the CSOs. We do still have a huge role to play, and I know most of the time, like Florence said, she actually voiced a fear that we might have where we do too much. We are now encroaching on what might be governmental roles and what is my role as a CSO and all. But I think especially when it comes to breastfeeding and mothers and the health of the nation, we can never do too much. The more collaboration we do, the better. And I feel sometimes even the health system is the one that gets lost somewhere in there, and yet they are front facing when it comes to mothers. But I think, like you said, Esther, we can never do too much. And the more that we do, and the more that we do in a way that is legitimate and unbiased, the better. So I think even the message there is for companies to be very careful about who is funding these rooms, who is, if it's not the organizations themselves who are doing it, who is donating the funds for this. Especially you can imagine in maybe the informal sector where the CSR is not a shed this time. They decide that the CSR is going to be that lactation room. But with all those posters showing, you know, the alternatives, all those breast milk substitutes, you know, so in a very hidden way, or the pamphlets that they give, there's always something there, or the groups that they form, you know. So I think it's also very important for us who are advocates to be aware of the fact that we don't have their big budget, which is why the code is there to begin with, because we understand how limited we are. But there's a lot that we can do to also promote and protect and support breastfeeding in a way that is seen and heard. So we must make it as loud as possible. Florence, like Esther has said, you know, you can be a benchmark for many others out there. Talk about it, put it out there, because it will inspire even other farms around you, other smaller organizations who think that they need a big budget, you know, or that you need to be a multinational company. But actually, it can start with one flower farm, and you can change an entire community, an entire belief system, an entire cultural system, and myth busting and everything. So parting words, please. Wangare, I'm so sorry you've been the most quiet. I'll start with you and your parting words, but thank you for being part of this webinar. So your parting words, please.
Thank you. For me, it's actually been awesome. It's been a learning process. I've learned a lot, and I feel like as a stakeholder, I need to even do more and get more involved. I deal with moms, and I feel there's so much to be done. I'm really impressed with Florence's case. That is really, really impressive. And I hope that in a few years or very soon, all companies will say they have such lactation rooms for their employees. So thank you for having me, and I hope to be involved more in supporting moms.
Definitely. Thank you, Wangari. Martha?
Thank you very much, Josie. First, I would like to thank you for this opportunity to talk about breastfeeding, because you see the theme for this year is protect breastfeeding, a shared responsibility. So it means everybody has a part to play to ensure that these babies are being breastfed. At the end of the day, we are talking about our future generation, and we need to keep them healthy. Something else is that I would like to encourage more employers to come on board and set up the lactation rooms for the moms. As you've heard there, we have a beautiful success story from Florence, from Florence's farm. And these are some of the things that we are looking out to. So please come on board and support these moms to combine the work and breastfeeding. So it is really, really important. And as CAMFEB, we do, I would say that all under one roof. So we really advocate for breastfeeding. We will make the policies for you. We're able to set up the lactation rooms for you, educate the moms for you, you know, your whole entire staff. So really, we are able to do so much to partner with organizations to enable us helping these moms to combine work and breastfeeding. So thank you very much, and maybe we need to take the conversation further and be reviewing such success stories of what is happening to have more people come on board. Thank you, Josie.
Yeah, that's true. We definitely need to review that. Martha, you've done a fantastic job in this space, and we are here to support you, and thank you for being such a wonderful pioneer. I think even then now, Florence, finally, as a final parting word. So if your final parting word.
So just to retaliate what I said, breastfeeding is a shared responsibility, right? For me, it's a strategic responsibility, because when you support a woman to breastfeed, you're not giving her a choice to give up what maybe a source of income. You're not giving her a choice to give up her source of income over taking care of her child, because naturally women will go into the natural instinct where I want to protect my child. But when you're actually giving her choices, for me it's giving her choices. You're actually broadening her horizons. You're actually giving her an opportunity to actually thrive, to have it all, in quotes, to have it all. You can actually have it all because someone simply put in a lactation room, gave you time to actually express and actually just supported you. And for me, especially in reference to Flossy's, the family, the flower farm, the productivity of women is coming up. You're seeing them taking more positions. You're seeing them not missing work. You're seeing their children are healthy. I mean, it's the ripple effect, even back to the economy, to the health sector, to the company in terms of bringing back income. You're not paying off sick offs. For me, it's phenomenal. So let's take up this. Let's take up this, not just advocacy. Let's implement it. Let's educate. Let's empower each and every person because it's strategic. Yeah.
Thank you, Eve. That is very, very true. Just there was a quick question I'm seeing on the page. Unfortunately, I hadn't been looking there, but I think this one will go to you, Esther. It's about the milk bank, and maybe it's somewhat related. Where is how far has the milk bank progressed? The one at one. Where is it? If you are able to share that information with us.
Okay, thank you, Josephine. So maybe just to answer that question, the Human Milk Bank in Pumwani was launched in 2019, and it is actually still operational. So 2019 to date, it's in its third year. So we celebrated 3 years since March 2019. So again, just to report that this bank was the first in the country, actually in the region. And the reason why we put it in Pumwani was because Pumwani is actually the largest mother-child hospital in this country. It's the largest maternity facility. And it has a huge newborn unit that hosts children who are born with lots of conditions. The reason why we thought about a human milk bank was because we have babies admitted in the newborn unit who are preterm, low birth weight, or other term sick babies. Something that is characteristic of preterm and low birth weight babies is that they're normally very small. Breast milk consumption is based on weight. And because the babies are very small, their requirements are normally very little. And so what happens, because this mom does not stop breastfeeding, does not stop producing milk because her baby is small. So what are we doing with the rest of the milk? If we don't make use of the milk, probably the mother would get engorged and probably come down with mastitis. So we thought of an innovative way and borrowing what has been done world over in other developed countries around how to utilize the excess milk. And excess milk here is the milk that the baby does not require that particular time. So we thought of supporting our mothers to be able to express that excess breast milk so that we can pasteurize it and use it for babies who cannot access their own mother's milk. And the access for the mother's milk may be limited because either the mother has died, the mother may be too ill to breastfeed the baby may have been abandoned, so there's no mother to actually breastfeed that baby. Okay, so and sometimes due to some conditions, the mother's milk actually may take long to come in or may not even come in at all. And to save a life, we actually need breast milk at that particular time. So that is how this bank was put up. And maybe just to emphasize, what actually keeps us going is to ensure that there's a rigorous recruitment process. The recruitment is actually, there's lactation counseling for the mother, and we need to identify potential donor. Once she's been identified, we are going to do some counseling. We are going to seek her consent, and then we do screening tests. And these screening tests are to ensure that we do not have any illnesses, any chronic illnesses, or any issues with the mother's health that may be passed on through her breast milk. And then once we recruit her, we are going to have we are going to be supporting her in our lactation center to be able to produce the milk. We provide the breast pumps, and we provide other equipment, and we have a standby counselor and a nutritionist who counsel the mother and guide. So that the milk that she expresses is subjected to bacteriological tests before it is pasteurized. So if it passes first bacteriological test, then it is pasteurized. After pasteurization, we do another one. And after it is certified as safe, then we store it in our bank. Now that is the bank where we store the milk. And so the pediatricians are then going to prescribe the milk for any baby that needs the milk. So that is the story of the milk bank.
Fantastic. And do you see us expanding it further soon? Yes, in the near future, because I know right now even the mothers that you recruit are Pumwani mothers. Or are you recruiting now from the larger community, or is it the mothers who have already delivered there?
Okay, currently we are just sticking with the mothers within. You know, sometimes when you're bringing in a new innovation, it's better to do it on a small scale until you've proven that it's something that can be done at a larger scale. So the plan is now that the Ministry of Health is working on a policy that is going to see a scale up of this project, so that we can be able to transfer on the quality, you know, like all the requirements that are needed for the scale up process, because we do not want to scale up and then we have issues, and more especially safety of breast milk is something that is going to be very, very sensitive. So we do not want to put any baby's life at risk, because then the milk was either contaminated or the screening was not done properly.
Yeah, thank you for that. I agree. Even when you read about the different banks in various countries, even in South Africa, even in the UK, it's quite a rigorous process. It's not something that it takes just a few months or even a year or two, but at least we have started, and I think there is hope, and it's wonderful that even the babies at Pumwani have that, have access to human breast milk, and hopefully in a few years we'll be talking about it being a widespread, accessible to the community at large. So thank you so much for answering that question, and especially in such detail. I think we have actually come to the end of our time, and thank you so much to my wonderful panelists for being so patient with us and all our technical issues, including KPLC trying to bring us down, but they did not succeed. So I am so grateful for this conversation. I am grateful for the things that it has allowed us to explore, to discuss. And more so, I hope we have each of us forged a path knowing what we are going to do for the rest of this year, because we talk about World Breastfeeding Week, but this is actually the theme for the next year. So what role are we going to play? What responsibility are we going to take up, whether it is as individuals, as Wangare there was saying, whether it is CSOs such as even myself as the Kenya Association for Breastfeeding, whether it is social enterprises like Maziwa. I think all of us have a role to play in whether it's pushing our HR departments, whether it's sensitization. But thank you so much, ladies, for sparking that in me, definitely. And I'm sure anyone who watches this will also be quite motivated. So thank you all again. Have a good night, and continue your wonderful work in advocacy, and God bless. Thank you.
Thank you.
Thank you, Chumbi.
Okay,
Good night. Bye.
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 Bye.